Welcome everyone to the next event of Public Health Genetics Week. My name is Megan Lyon. I am Associate Project Director for the National Coordinating Center for the Regional Genetics Networks. NCC hosts the annual Public Health Genetics Week, and we are very excited to have Baby's First Test with us to talk about updates in newborn screening policy, technology, and research. Where are we now? So with that, I will pass it off to Natasha Bonham for the conversation. Thank you so much.
Great, thank you so much. I think we have a video that's going to start.
Good afternoon and welcome everybody to this webinar for Public Health Genetics Week. We are so excited to be joining you all today, and thank you for the opportunity to share updates in newborn screening around current technologies, policy, and research. And we're really just eager to share with you an overview of where are we now with newborn screening. We'd like to first start by thanking the Planning Committee of the Public Health Genetics Week. Thank you so much for the opportunity to join your amazing agenda of a number of different activities, and we're just thrilled to be a part of this week. Next, we'd like to take just a few moments to introduce you to the team behind Baby's First Test. First, we have Ms. Brianne Miller, who is the Program Manager of Newborn Screening Initiatives here at Expecting Health. Next, we have Ms. Natasha Bonham, who is the founder of Expecting Health and has really spent her entire career dedicated to supporting newborn screening initiatives and initiatives in maternal and child health. And last, we have myself, Ms. Mariana Rea. I am a genetic counselor by training, and I'm currently the Associate Director of Programs here at Expecting Health. And this team, again, is very excited and eager to share these updates about newborn screening with you all today. I want to just walk through a brief agenda of what we have planned. First, we're going to share a little bit with you about who we are, really learning a bit more about Expecting Health and who Baby's First Test is for those of you that may not be as familiar. Next, we're going to take a few moments to just relearn or learn what newborn screening is and why it's important. And last but not least, we'll take some time to explore updates in newborn screening, really focusing in on what has changed in newborn screening since its inception in the 1960s and really reflecting on where we are today. But first, I'd like to take a moment to introduce you to Expecting Health for those of you listening in that may not be as familiar. Expecting Health is a nonprofit organization that is really dedicated to taking the fear and confusion that many families face during pregnancy and throughout their parenting journey and replace that fear and confusion with confidence and agency to really make the best healthcare decisions possible for their lives. And we do that through a variety of different programs and in a variety of different ways, all with the main goal in mind to alleviate those pain points and that confusion for families. There are, as I mentioned, a number of different programs that Expecting Health supports that all specifically relate to newborn screening. Today, we'll focus primarily on the work of the top two programs that you see listed here, Baby's First Test and our Newborn Screening Family Education Program, or otherwise known as Navigate Newborn Screening. But Expecting Health also has a number of programs that support other aspects of both public health and family support. Our National Genetics Education and Family Support Center is really dedicated to supporting families who are navigating genetics journeys, and we are available and work with a number of different partners to provide technical assistance and content development in many areas of public health, genetics, family engagement, and other areas of maternal health. So what or who exactly is Baby's First Test? Well, Baby's First Test started as a website that was dedicated to providing information about newborn screening to both families and providers. So on this website, you can find quite a bit of information about the specific conditions that are screened for by your state, and as well as additional information on each of those conditions. But in addition to being a great website, Baby's First Test really focuses on 3 additional pillars, including 1, education. So on the website, but through Baby's First Test, we've created a host of different educational tools, resources, and materials that are available to families to use, as well as to providers to share with families that they are working with. Baby's First Test is also focused on engaging, again, both families and providers in generating awareness for newborn screening. And we do that through a host of efforts, particularly in the month of September around Newborn Screening Awareness Month. So if you haven't seen us, you can definitely check us out in the month of September. We have oftentimes toolkits to help support and raise awareness for newborn screening through social media. We host a number of different webinars for you and for everyone to learn more about newborn screening and current topics in newborn screening. And we really invite everyone to join the community and to participate in raising awareness for newborn screening. And last but certainly not least, Baby's First Test really focuses on collaboration. And we do that by creating and convening different networks of various different stakeholders and experts that are involved in the newborn screening system. And one particular example of this is our newly formed work group, which we're calling Connect, which is the community of newborn screening experts collaborating together with a specific focus on congenital cytomegalovirus. So we invite all of you to visit us at babiesfirsttest.org to learn more about these tools, resources, as well as education, engagement, and opportunities for collaboration. Recognizing that the goal of Public Health Genetics Week is to increase awareness and to celebrate the efforts of the public health genetics system, we wanted to take a few moments to highlight some key points about the importance of newborn screening. Newborn screening is one of the largest, most successful public health programs in the United States. All babies born in the United States have newborn screening, and most conditions that are identified through newborn screening are genetic. Every state, district, and territory in the United States has a newborn screening program. And while guidance is provided at the federal level regarding which conditions are recommended to be included, ultimately each state determines the specific conditions and requirements of their state's panel. Newborn screening is a critical public health screening program as it's designed to identify newborns who may appear healthy at birth but are at risk for developing serious health conditions. Each year, it is estimated that around 12,500 babies are identified with a condition through newborn screening, and the process of identifying these children early and before symptoms may even appear gives these children and their families the opportunity to begin treatment interventions and to receive care as quickly as possible. There are typically 3 components to newborn screening, and each is performed usually within 24 to 48 hours of a baby's birth. The first part to newborn screening is typically the blood test. This involves the collection of a small blood spot sample from a baby's heel. These small drops of blood are typically placed on a sample collection card, or it's sometimes referred to as a blood spot card, and mailed to the state's laboratory for analysis of a number of serious but treatable conditions. Another component of newborn screening includes the pulse oximetry test, which measures the amount of oxygen in a baby's blood, and it's used to screen babies for possible heart problems that are often referred to as critical congenital heart defects, or CCHD for short. The final part to newborn screening involves a hearing test in newborns to assess for possible hearing loss or deafness. Each of these components is usually completed before a baby leaves the hospital, and for babies that may be born outside of the hospital, families are encouraged to work with their birthing provider to ensure that these screens are done within the recommended time frame. We'd like to introduce you to a young girl who was diagnosed with maple syrup urine disease through newborn screening. As you can see here from her mother's words, this screen was the blood draw that would reveal she had a life-threatening, treatable metabolic disorder called maple syrup urine disease. Because of this public health program, we were able to get a timely and accurate diagnosis, begin treatment, and prevent irreversible brain damage. We are forever thankful for newborn screening. Now that we've laid a bit of foundation for what newborn screening is and why it's important, I'd like to next walk through a bit of historical perspective regarding the expansion of newborn screening conditions over the last several decades. So newborn screening, as many of you already know, was initially developed in the 1960s by Dr. Robert Guthrie. And Dr. Guthrie's methods were to use blood spots on filter paper to screen for one specific condition. And this was PKU, or it's also known as phenylketonuria. And this method was quickly adopted by other states. So what started as screening for one condition really quickly gained appreciation for its importance and the ability to identify and help more babies with PKU earlier on. So for many years, this work and the work of Dr. Guthrie was used to implement screening programs across many different states. Then over the next 3 decades, additional conditions were slowly added to screening panels using that same dried blood spot method, all with the continued goal in mind of early identification of children with these conditions. Things like congenital hypothyroidism, maple syrup urine disease, hemoglobinopathies, and galactosemia were some of the first conditions to be added after the initial screen of PKU. And it wasn't until the 1990s that screening for hearing loss was implemented. And this was a bit of a shift in the newborn screening system at that point in time, because this really required new technologies, different types of equipment to be used, and overall different strategies for implementation across all states. Given that there were definitely an increasing number of conditions being added, and really with the idea of supporting states in mind in their efforts to implement more uniform panels, there was legislation passed in 2008, which helped to establish the Recommended Uniform Screening Panel, or the RUSP. In 2008, there were 29 core conditions that had been recommended by the Advisory Committee of Heritable Disorders in Newborns and Children, or it's also referred to as the ACH-DNC, as well as, and the ACH-DNC made recommendations that were approved by the Secretary of Health and Human Services. So in 2008, there were 29 of these conditions that were part of the core condition list of the RUSP. And the RUSP provides guidance for recommended conditions, but ultimately each state is responsible for determining which conditions are included in their panel. As we'll share in a few slides here in just a moment, the process to have a condition nominated and reviewed and recommended by the RUSP really requires a significant amount of support from both the federal and state levels, as well as local levels. And in some cases, it can take several to many years to achieve this goal. Since the RUSP was initially established in 2008, there have since been a number of additional conditions that have been added to the Recommended Uniform Screening Panel. These do include critical congenital heart disease, which, like hearing screening, also requires different technologies, equipment, and implementation strategies, to ensure that every single baby has CCHD screening before leaving the hospital after birth. Other conditions include severe combined immunodeficiency, or SCID, Pompe disease, mucopolysaccharidosis type 1, X-linked adrenoleukodystrophy, and spinal muscular atrophy. The addition of each of these conditions required significant efforts from advocacy and family leadership groups, as well as collaboration and review from the Advisory Committee of Heritable Disorders of Newborns and Children. And that's what brings us to where we are today. Currently, there are 35 conditions on the RUSP, with recent votes from the Advisory Committee to add new conditions, including MPS II and GAMP deficiency. In addition, we are at a very interesting time in a healthcare system where newer technologies and treatments are becoming available, and they're becoming available more quickly. And this really creates new opportunities for states to pilot new approaches, new technologies, and to further expand the potential impacts of a public health screening program in newborns. Ultimately, as we reflect on the expansion of newborn screening programs over the last 60 years, we've seen the addition of more conditions. We've seen an expansion to include different condition types, including metabolic conditions, endocrine conditions, hemoglobinopathies, immune deficiencies, hearing loss, heart defects, and so many more. And it's through the development and implementation of new technologies that have allowed us and will continue to shape the future of newborn screening programs. So we've established thus far what newborn screening is and why it's important. And we've shown that the systems and practices of newborn screening are definitely evolving over time. So we want to next focus on the role that advocacy and policy have on driving changes or supporting changes within the newborn screening system. Here at Expecting Health, we often say that newborn screening is more than just a screen at birth. It's a complex system involving multiple stakeholders. So in the next few slides, I'd like to share some examples and some specific opportunities for involvement in advocacy and policy efforts, thinking about it from the national or federal level, the state level, and then what you as an individual can do as well to support advocacy and policy efforts in newborn screening. So let's first take a look from the federal level. And in 2008, as we've talked about before, Congress passed legislation, and the original Newborn Screening Saves Lives Act was passed in 2008, which really helped to establish guidelines for newborn screening through the RUSP, but it also helped to ensure the setup and establishment of comprehensive newborn screening programs in every state. As new conditions and new technologies were added to newborn screening programs, there was also an evolving need for support activities such as education, policy implementation, and program efforts. So through the Newborn Screening Saves Lives Act, there was support for all of these activities. Currently, the Newborn Screening Saves Lives Reauthorization Act was reintroduced in 2021. And this is key, again, to reauthorizing these federal programs that help support states to improve and expand their newborn screening programs. But it also supports newborn screening educational efforts for both families and healthcare providers. And this is done through a number of different programmatic activities. One, which I'll specifically share with you in just a moment, the Newborn Screening Family Education Program, which is supported through federal funding. And then lastly, the Newborn Screening Saves Lives Reauthorization Act also ensures that labs are able to continue maintaining their comprehensive newborn screening programs. So it really is an important piece of legislation that really helps to ensure that these specific activities supporting newborn screening are in place. And there are many individuals and organizations that are supporting the efforts and the signing of the Newborn Screening Saves Lives Reauthorization Act of 2021 to ensure that this funding can continue to support the many educational awareness and quality improvement efforts that are currently in place and needed in newborn screening. And additionally, there are many advocacy and family organizations who are collaborating with clinicians, with researchers, and with other federal partners to nominate conditions for the RUSP. As we talked about earlier, once the RUSP was created, there have been a number of conditions over the years that have been added to this recommended panel. And as I mentioned in the previous slide, spinal muscular atrophy was actually added to the RUSP in 2018. Since then, there have been additional conditions that have been considered or nominated for addition to the RUSP. So as you can see here in this slide, there is an extensive process for not only nominating, but reviewing, voting, and ultimately having a condition recommended to be added to the RUSP. And specifically in the last year, there have been two conditions, MPS II and GAMP deficiency, that were recently voted on, and a recommendation has been made to the Secretary of Health and Human Services to have these two conditions added to the RUSP. But in addition, there are a number of other conditions, some which you see here and some which you don't, that have also had a number of advocacy groups, parent and family groups, and other groups who are supporting the process to have these conditions such as Krabbe and congenital cytomegalovirus also added to the RUSP. And these conditions and the work involved in that process really can be at varied points. So what we really want to drive home here is that having a condition added to the RUSP for some conditions has taken extensive time, and in some cases even up to 10 years to have a condition added to the RUSP. And it really does require support from multiple levels and multiple partners at the federal level, so federal support, as well as advocacy groups at the national and local levels. In addition to federal and national efforts to support newborn screening policies and advocacy efforts, there are also state-specific efforts as well. So as more conditions have been added to the RUSP, states have more to consider in terms of what, when, and how they can implement these newly added conditions. So for states, there can be a number of factors, including staff, equipment, and even costs, just to name a few. And the time it takes to implement these new conditions can certainly vary significantly from state to state based on these factors. So one thing we wanted to make you all aware of, in an effort to generate some or more alignment across states to implement these new conditions within a designated time frame once they're added to the RUSP, there are RUSP alignment legislations being passed in a number of different states. And this legislation really is focused on requiring that states screen newborn babies for all of the disorders that are on the RUSP. It also ensures that resources will be available to fund all conditions added to the RUSP in the future. And the third part is that it focuses on implementing within a certain timeline. So states are, based on legislation being passed in that state, states are expected to begin screening for the new disorders within a specified time frame from the time that condition is added to the RUSP. And currently, the Every Life Foundation is leading these efforts, and RUSP alignment legislation has been signed in 10 states. So lastly, we also wanted to just share a little bit more about advocacy at the individual level, and recognizing that advocacy does happen at the individual level. And one particular program that we're eager to share more about is the Navigate Newborn Screening Ambassador Program. And this was initially launched in October of 2021. And currently this group includes 12 family leaders who all share a passion for improving the newborn screening system. And the goals of this group really focus on 3 key areas, the first being to build community, and specifically to build community by connecting with other families and developing relationships at the local, regional, and national levels among newborn screening stakeholders. The second goal is for individuals in this group to develop their own leadership and advocacy skills. And we do that through a variety of trainings, practices, and application of these skills through different activities. And the last and final goal is to increase awareness of the importance and the value of newborn screening, specifically by having members of this group share their stories within their own communities, as well as with their state and national representatives. So again, through a variety of activities, trainings, and opportunities to share their personal journeys within the newborn screening system, this group is really proving to be an excellent resource to others who are interested in learning more about navigating the newborn screening system. So to highlight the work of this group, we wanted to share a specific example of one of our ambassadors sharing a bit more about her experiences and her journey with newborn screening.
I would like to invite you all to imagine something. So if you would, please close your eyes and visualize with me. Imagine that you're on the beach with your family. You hear the sounds of the waves, feel the warm sun on your body, and feel the sand between your toes. And the best part is, you hear the laughter of your 2 precious little boys, ages 5 and 2, as they experience the magic and excitement of the ocean. These are memories in the making. Now, please open your eyes. 2 days later, this is your reality. Everything has changed. This was the day that turned our world upside down. This was the day that our sweet, bubbly, and full of life Elliot, at 2 years old, was placed into a medically induced coma and put on the ICU floor of the Children's Hospital, where he would remain for 29 days. Elliot was having seizures with no outward signs, and doctors couldn't figure out why. They would later find out that the seizures were a result of pretty extensive clotting throughout the brain, which ultimately resulted in Elliot having a stroke. I will never forget the words spoken to us by doctors on July 15th, 2018. We need you to know how serious this is. We don't expect to lose Elliot to this, but you need to know that we could. And I can tell you that at that moment, I've never felt more helpless or afraid. It would be what seemed like an eternity, but was really just 11 days after Elliot was admitted to the ICU that doctors were able to pinpoint a cause for everything. Homocystinuria, they told us. It's a rare genetic metabolic condition, and we think that's what Elliot has. As grateful as we were for a diagnosis, because it meant that we could move forward with a plan, we found ourselves wondering that if HCU were a genetic condition, why had we never heard of it? Wouldn't we have found out when Elliot was born that he had this rare condition? Fast forward to today. We now know that my husband and I are both carriers for this rare condition called HCU. We've also learned that when Elliot was a newborn in the hospital, homocystinuria was something that he was screened for. But unfortunately, Elliot was missed at newborn screening. I don't like to live life with what ifs, but I often find myself wondering how differently things could have turned out for Elliot and for our family if we had known in the beginning that Elliot had a serious condition. We could have prepared, we could have given him the medications that he needed, and we could have avoided almost losing him. Thankfully, Elliot is doing wonderfully today. In fact, he's better than ever. I call him Elliot 2.0. He is happy, full of energy, and just as feisty as any 5-year-old should be. We were lucky and we're very, very blessed. My hope now is that there are medical advancements that continue to be made so that Elliot may live the most normal life possible. I also hope and pray that no family has to go through the experience of almost losing a child to this condition. I know that newborn screening labs are passionate about detecting these conditions in newborns to give them the best chance of early treatment and avoiding the potentially devastating effects of the disease. I hope that developments are continually made so that all HCU families can close their eyes and imagine their Elliots in a scene on the beach and not in the ICU. Thank you.
And a big thank you to Liz for sharing her story and her journey with us, and to the many other family leaders and advocates who have also shared their stories as well. It is because of these efforts, again, at the national and federal level, at the state level, and through individuals like Liz, that we are able to push forward and make improvements and changes to the newborn screening system. So as we shift into this last section or last area of this webinar, we will be looking to share with you all specific updates around some research and educational efforts that are happening within the newborn screening system. And really, there are a number of different areas of research in newborn screening. And while we won't go through all of these in detail today, we wanted to just point out a few key areas for research within the newborn screening system. So first, there are a number of pilot programs at the state and regional level to implement the evaluation of screening for new conditions. Secondly, there are a number of different efforts related to improving the way in which newborn screening results are communicated and delivered. And lastly, and where we'll focus for the remainder of the webinar today, are efforts to improve parent and provider education and awareness for newborn screening. So I wanted to take a moment to quickly shift to share with you a bit more about one of the additional programs related to newborn screening that's managed here at Expecting Health. And the Newborn Screening Family Education Program, or Navigate Newborn Screening, which we often refer to it as, is a 5-year grant-funded program that is dedicated to creating education and awareness opportunities for families to learn more about the newborn screening system, and specifically to create opportunities for families to become leaders within the newborn screening system. This work is funded by our partners, and we'd like to thank the Health Resources and Services Administration for funding this 5-year program. Over the course of this program, a number of different tools and resources have been made available to families, including online curriculums, video education, infographics, social media efforts, and a variety of other educational tools. But what I'd like to specifically focus on today is a pilot program that we launched to raise awareness about newborn screening, specifically in medically underserved communities of expecting mothers. And in this pilot program, there were 3 specific objectives that we focused in on. The first was to increase awareness of the process and importance of newborn screening in medically underserved populations by introducing education during routine pregnancy visits. And our thinking here was that, many families don't identify or don't learn about newborn screening oftentimes until after newborn screening has occurred. So if we could raise awareness about newborn screening prior to the screen happening, our thinking and feeling and hope was that we could improve the experiences for families that are going through the process of newborn screening. In addition, one of our objectives for this pilot program was to assess the accuracy of knowledge regarding how, when, and why newborn screening occurs. So we really wanted to try to get an understanding of what families know about newborn screening during pregnancy, and if providing them education could raise their level of knowledge and help them feel more confident to ask and answer questions related to newborn screening once they have screening at delivery. And the final objective was to provide resources for families to be able to find additional information regarding newborn screening if they were to find themselves in a situation where they may be experiencing an out-of-range newborn screening result. So how exactly did this pilot model work? Well, first, the idea was to identify community partners working with expecting and pregnant mothers in medically underserved communities. And then what we did was ask clinic staff to identify 3rd trimester patients and provide those patients with the opportunity to participate in an educational initiative regarding newborn screening. So in some cases, this took place in a clinic setting, while in other places, we partnered with local midwives who were visiting with families in their homes during their 3rd trimester visits. And in either scenario, we utilized and developed specific tools, such as an information card that included a QR code or paper resources to encourage the patient and to inform patients about the importance of newborn screening and to let them know that they had an opportunity to participate in an educational initiative to raise their awareness and knowledge of newborn screening. Those that chose to participate were asked to answer a set of pre- and post-test education questions, and then they were asked to review a learning book that included specific information about how newborn screening occurs, when newborn screening occurs, the possible results that you could obtain from newborn screening, and what to do if your newborn screening results come back out of range. So as we start to look into the results of these efforts, we found that many participating individuals could not correctly identify the definition of newborn screening before reading the short learning book. So we asked participants to identify the definition of newborn screening from a list of multiple choice options, which you see listed here on the left-hand side of this image. Prior to reading the book, only about 32% of individuals could identify from that list the correct definition of newborn screening, which we used is that newborn screening is a test done between 24 to 48 hours after birth. However, after reading the book, you can see a significant increase to about 86% of individuals were able to identify the correct answer. So we know that by reading the information that was provided in the learning book, that we were able to raise knowledge about specifics around newborn screening. And there were a variety of other questions that were asked as well, but we will not go through in detail today. We also asked individuals to respond to questions regarding their personal confidence, trust in the information provided, and their abilities to locate additional newborn screening information. So again, as you can see from the high percentages in the bar graphs shown here, the majority of individuals felt they knew more about newborn screening and that knowing about newborn screening is important to them. Additionally, participants reported a high level of trust in the education they received through this initiative, and they also felt more capable to talk to their doctor or ask questions about newborn screening information after this. And nearly all individuals who participated felt they knew where to look for more information about newborn screening. So overall, this pilot program is just one step in the efforts to support awareness of newborn screening in prenatal settings. And we do hope to expand on these efforts and continue to partner with additional community partners, specifically working with expecting individuals and in medically underserved communities to support and raise awareness and education for newborn screening. So if you happen to have interest in this or know of others that do, please do not hesitate to reach out to us. And lastly, before I wrap up, in addition to the prenatal education book that I just shared a bit about, the Newborn Screening Family Education Program also has a number of additional tools and resources to support family education and newborn screening. So please do not hesitate to reach out to us for more information if you're interested. So some final conclusions and thoughts before we open up for questions and discussion. And to just sort of summarize all that has been shared in this webinar today, newborn screening is an ever-evolving and expanding public health program. These expansions and changes are largely due to advancements in technology, support through advocacy and policy, as well as research and education. And continued collaboration among stakeholders is key to the success and the continued success of this comprehensive public health system. We thank you so much for joining us today. And now we would be more than happy to answer any questions that you might have or open it up for discussion. Thank you so much.
Hi, everyone. This is Natasha Bonham, and there are a couple of questions that have come in that I will be happy to address today. But if you have any more questions, please be sure to send them in. One is, are the learning books going to be available in other languages besides English? And the answer to that is yes. Majority of our materials are already in Spanish as well as in English. That includes the different education modules we have and flyers and materials of that sort. So you can just reach out to us and we will connect you with those materials that are in Spanish. We would love to partner with other organizations and groups to be able to translate these materials in other languages. So if there's a particular language you're interested in, please reach out to us and we can work together to make that happen. Another question that's come in is, what are some ways we would educate a parent or family who is unaware of the benefits of newborn screening and may even reject screening due to their culture and experience? I think this is a great question and a really important one. We have to remember that families are really bombarded with information during the pregnancy period, and it can be really difficult to sort everything out and to try to make sense of it all. And so one thing that we really encourage people to do is to really talk to the families and to see if there are concerns about newborn screening. What is it? Do they understand what screening is? There are some parents who, and this is from a study we did a couple of years ago, who really didn't want their children vaccinated or wanted to understand more about vaccines. And when we explained that newborn screening isn't a vaccine, it isn't putting something into your child's body, but it is, just taking a few samples of blood and then also doing a couple of external exams, families were more comfortable with that because they thought, okay, that's all right. So it really is to understand what is the concern or the barrier or the limitation, and to see if there's a way to work around that, or even just to provide education and understanding so that the family can say, oh, okay, this is what it is. It's not that. But I think all of this starts at a place of a conversation. And so often we know that in the prenatal setting, people are not talking about newborn screening, so there isn't that time. And then sometimes the parent feels like they're trying to make a decision at the last minute or not having all the information that they would want. So, again, that's one reason why we really have started to focus in on that prenatal period. Another question has come in that we touched on how much information parents receive in the prenatal period beyond the learning book. Are there other strategies we have explored to increase education without overloading parents? Absolutely. And in all of the work that we do through Expecting Health, we say awareness is different from education, and education is different from training, and training is different from engagement. They all have different layers. So, some of our more awareness building opportunities are we have embarked on a project that's really looking at what can be the impact of using social media and more passive messages to be able to educate a broad public. So we just started off a more in-depth review of that project. So for the next 6 months, we will be posting ads on Facebook and really looking to see and very much honing in where those ads are shown to people within certain age ranges as well as those who fit the description of being part of a medically underserved community. And that may be based on region or a number of other factors. So we're really trying to test that to see, okay, can we get these messages out there? So even if someone doesn't read a whole book and really know the ins and outs of newborn screening, can we at least get the information out there, even if it's in a more passive way, to say, newborn screening, learn a bit more. And they can go to a page that has just a bit of information, just so that they know what to expect. So we're in the process of testing that. But one thing that I think is really important that we're really trying to integrate is both what are the things we think families need to know, and really more importantly, what are families motivated by, right? Just as you said, there's so much information coming out. There's so much that families tend to feel like they already don't know about. And when we educate about newborn screening, it can be a little bit difficult because there isn't necessarily an action to take, right? You don't sign up for newborn screening, it happens automatically. And while that is absolutely the way we want it to go, that can be a little bit difficult when someone's trying to learn about something and yet there isn't quite something to apply. We typically try to apply the message of be sure to ask your provider at your baby's second or third well baby visit. But again, these are all things that we're considering. And so hopefully when we have a bit more data from the work that we're doing on our social media fronts and really analyzing that and not just putting a post for no reason, but really trying to see what we can learn and how far that goes, we'll be able to share that with the community. So for that particular project, we have focused on Facebook for a couple of reasons. One, the analytics are there in a way that makes it a bit easier for us to track some things. And two, there are a range of people who are on Facebook, and so we're trying to see what impact that has. And oftentimes people may post pictures and engage with Facebook in a way that's kind of more around sharing information about family, and trying to see where that is. That being said, we really know how as demographics change and different technologies and platforms come out, we know that there are a lot of millennials on Instagram. And so that is one thing that we're looking to do in the future, to take our lessons learned from Facebook and try to see, okay, what does that look like on Instagram? That's a pretty different platform in terms of very visually oriented, a lot of videos. It's not just pictures, but really having that sense of movement in the content that you're posting. So really seeing, okay, what would that look like for us there? And we have just started to look into what health-related social media posts, when looking at platforms like TikTok, actually are having an impact. So, right, on all these platforms, there's a lot put out there, there's a lot of noise, but we're really trying to see, okay, in the realm that we are working in, which is health information, are there either models or people who are really making a difference from that health perspective? And we started to see that a little bit on TikTok, I think, particularly after COVID, or I should say through COVID, and a couple of other particular places. Nutrition is a place that has done very well on social media with registered dietitians. So that's just an area that we're looking at and trying to learn more and to see what would really make a positive impact. We don't want to be on a whole bunch of different platforms if it's actually not reaching the goal of reaching families and helping them make the best health decisions for themselves. All right, I believe that's everything. Again, thank you so much for the opportunity to share this information and to update this group about all the wonderful things happening in newborn screening right now.